Hello everyone, I am your friend Olufemi Bolaniwa. Today I have brought you another very important health topic, and this is especially very useful for people who enjoy their coffee. For some people, early morning coffee is a blessing because it gives them the drive to start their day. Some people have described coffee as the energy boost they need to start working every morning. But is there something you should be worried about regarding drinking of coffee? Come, let's talk about it. Let's start by looking at the relationship between coffee and medications, and that's basically what we are going to be talking about today: coffee and medications. Coffee contains proteins, caffeine, lipids, carbohydrates, and chlorogenic acids. But for today, we are concerned about caffeine, which is arguably the most important ingredient in coffee, which can significantly affect how certain medications work in the body. Depending on the drug, caffeine can boost effectiveness, it can block absorption, it can intensify the side effects, or cause very dangerous interactions. When you understand how these interactions work, you will be better able to make safer choices with both your prescription and over the counter drugs. Let's start with the good side. When you take coffee and pain relievers such as ibuprofen, paracetamol, acetaminophen, the interaction can be that it will increase the effectiveness of pain relief of these medications. Studies show that drinking a strong cup of coffee, that's about 100 milligram of caffeine, increases the effectiveness of common painkillers by almost 10%. And this is because caffeine helps the medicine absorb faster and remain in your system longer. But you need to avoid excessive caffeine if you are sensitive to stimulants. Number two, coffee with cold and allergy medications such as loratadine, nasal spray, Claritin, Sudafed, and so on and so forth. Now, what happens if you combine coffee with these drugs? There is a heightened risk of overstimulation and sleep disturbance. There is something called pseudoephedrine, which is the main component in cold and allergy medications. This thing is already a stimulant. So when you now combine it with coffee, which also has the ability to stimulate, it can cause jitters, restlessness, insomnia. Insomnia is the lack of sleep, inability to fall asleep. Increased blood sugar can also be a cause. I'm sorry, can also be an effect. And this is dangerous for people with diabetes. Number three, blood pressure medications. Caffeine can negatively interfere with the purpose of the medication. And we all know that blood pressure drug works by slowing down your heart rate or by relaxing the blood vessels. Caffeine does the exact opposite. It increases your heart rate and tightens your blood vessels. So this can reduce medication effectiveness. It can cause blood pressure spikes. It can increase long-term risk of stroke and heart disease. Instead of coffee, you may want to use alternative energy sources such as nuts and fruits. Number four, coffee and anticoagulants. Anticoagulants are simply described as blood thinners. An example of, a very common example of blood thinners is warfarin. The interaction between coffee and blood thinners is that it can increase the risk of bleeding because both caffeine and blood thinners slow the body's ability to clot. Clotting means to stop bleeding. The body undergoes some processes that will make it to get thick and then, eventually stop the bleeding in case there is an injury. Now, caffeine and warfarin coming together will slow the body's ability to clot, and together they may cause excessive bruising, nose bleeds, and hard to stop bleeding. Moderation is important in everything we do. So if you're on blood thinners, please consult your doctor about the safe amount of coffee to take. Number 5, thyroid medication. The most common one is levothyroxine. And the interaction between coffee and levothyroxine is that it reduces medication absorption. When you drink coffee too soon after taking levothyroxine, it can make it less effective, you know. And the effects may include persistent fatigue, weight gain, constipation, cold intolerance. These are all the things that are caused initially by, low level of thyroid activity for which you are taking levothyroxine. So when you now mix coffee with levothyroxine, coffee is going to hinder the effectiveness of this drug, and the symptoms of the low level of thyroid activity in your body is going to persist. What can you do? Practically, what you can do is to wait for about 30 minutes to 1 hour after taking your thyroid medication before drinking coffee. Now, number 6, and this is very important, antidepressants. If you are taking antidepressants, you need to talk to your doctor before you use any amount of coffee at all. This is because caffeine interacts differently depending on the class of antidepressants that you are taking. Now, for the sake of this discussion, let's focus on the class of antidepressants known as SSRI, selective serotonin reuptake inhibitors, because they are the most commonly prescribed antidepressants. They work by increasing the amount of serotonin available in the brain to improve the mood. Serotonin is also known as happiness hormone. Now, what caffeine does is that it keeps this drug in your system longer, and eventually it can trigger what is called the serotonin syndrome, causing things like agitation, confusion, rapid heart rate, dangerous increase in blood pressure, and muscle tremors. You can imagine what it feels like if you your mood is beautiful, you are happy, you are jumpy, you are alert for a considerable long period of time. It's going to cause the stress level of the body to spike, and this is not good at all. You know, Generally, coffee plus antidepressant worsen anxiety and insomnia. Insomnia, again, is lack of the ability to fall asleep. And remember, these are the two symptoms already associated with depression. So, if you are taking antidepressants with coffee, you are inadvertently fighting against the exact solution you were pursuing. So again, talk to your doctor if you cannot do without drinking coffee and you are taking antidepressants at the same time. Number 7, coffee and diabetes medications. Diabetes is generally about blood sugar instability, either too much blood or too little. I'm sorry, either too much sugar in the blood or too little sugar in the blood. That's the best way to look at it. Now, caffeine can disrupt how the body uses insulin, and this can cause spikes or crashes in blood sugar. In other words, it can make your blood sugar to go up rapidly or to come down rapidly without warning. Anyone who is diabetic or who understands how diabetes works will tell you straight that these are two extremes of the continuum you want to avoid at all times, because it can be a matter of life and death, a life and death within minutes. Now, people who are struggling to control their blood sugar should consider reducing caffeine intake immediately, and they should also talk to their doctor. Number 8, which is the last one, milky coffee and medications. This is when your coffee has milk, and of course, this happens most of the time. The calcium in milk, now this is not about caffeine directly, it is about the milk that you need to put in your coffee to make it tasty and all that. So the calcium in the milk and the caffeine in the coffee are the primary component responsible for this negative interaction by binding with the active components of the medication and blocking its absorption. So large amounts of milk can interfere with some antibiotics, it can interfere with thyroid medication, it can interfere with iron supplements. Calcium binds with all these types of medications and make them less absorbable. So the body is not able to use them. The best advice is that you should take such medications after several hours you have consumed milk, or several hours before you decide to consume milk, milky coffee or milk in itself. Um, the key messages in this video has been that coffee is harmless on its own, it's harmless. But when it is mixed with certain medications, you should be careful because it can boost benefits, it can, boost it too much, it can block absorption, and it can create dangerous side effects, making it eventually harmful. As usual, talk to your doctor when you have concerns about your health stemming from any video like this that you see on YouTube. Thank you so much for listening. Please share with your friends and family, subscribe, and also encourage them to do the same. And until I come your way again another time, please take your coffee with caution. Thank you so much.